The Orasure HIV-1 oral specimen collection device is a non-invasive way to collect specimens to be tested for antibodies to the HIV-1 virus. We hope that you will find Orasure HIV-1 to be a valuable tool.
The purpose of this video is to teach you about the proper collection of Orasure HIV-1 specimens to be tested for antibodies to the HIV-1 virus. A written transcript of the video is also available so that you can follow along and refer to it later. And after the video, you'll be given a quiz. First, let's take a look at the materials provided. The Orasure HIV-1 device itself consists of a collection pad and a specimen vial. The pad contains salts and proteins that facilitate the flow of antibodies from the lining of the gum and cheek into the mouth and onto the pad. The vial contains a preservative solution intended to preserve the specimen for up to 21 days after it is collected. This 21 days includes the time the lab needs to test the specimen. At the lab, the oral fluid collected by the device will be measured and tested for antibodies to the HIV-1 virus. The Orasure HIV-1 package insert should be familiar to you before you begin to collect specimens. It contains information about how the device works, restrictions, warnings, precautions, directions for use, storage and transportation of Orasure HIV-1 specimens to the testing laboratory, interpretation of results, limitations of the procedure, and performance characteristics. Next is the subject information pamphlet. This pamphlet contains important information on Orasure HIV and AIDS. This pamphlet should be given to each subject, and the subject should be given an opportunity to read it prior to the specimen collection, or it should be read to the subject prior to specimen collection. The subject information pamphlet provides important information about the limitations of the Orasure HIV-1 device and the meaning of a positive, a negative, or an indeterminate test result using an Orasure HIV-1 specimen. Also direct the subject's attention to the section on HIV and AIDS. This section contains important information about the HIV virus, risk factors for HIV infection, how people can protect themselves and others from becoming infected with the HIV virus, HIV testing, and how the Orasure HIV-1 device is used. Give the subject an opportunity to read this section prior to specimen collection. There are also some materials you'll need for Orasure HIV-1 specimen collection that are not provided. These are a timer for timing the 2-minute specimen collection, a sealable plastic bag at least 2 mils thick or similar container for handling and transporting a specimen if the specimen is not collected in a medical setting, a styrofoam or plastic cooler with a cold pack for protecting the specimen from temperatures exceeding 98 degrees Fahrenheit, direct sunlight, and impact, and an informed consent form consistent with the laws of your state. Before you collect an Orasure HIV-1 specimen, you need to do the following. Explain the product to the prospective subject, including its restrictions, such as the Orasure HIV-1 device must be purchased by a physician, the device can only be used by trained collectors designated by a physician, and the device must not be taken home for collecting a specimen or used to screen blood donors. Explain to a prospective subject the meaning of a positive, negative, or indeterminate test result, including the fact that test results are wrong more often using an Orasure HIV-1 specimen than using a blood specimen, and 1 or 2 truly infected people will be missed out of every 100 tested using Orasure HIV-1 specimens, and 2 or 3 truly infected people will receive an indeterminate test result out of every 100 tested using Orasure HIV-1. Give the prospective subject the subject information pamphlet, which contains information about Orasure HIV-1 testing, as well as general information about HIV and AIDS. Give the prospective subject an opportunity to read these materials, or if the subject cannot read the subject information material to the prospective subject. Tell the prospective subject they have a choice of what type of specimen to use for HIV antibody testing. Tell the prospective subject about their rights regarding confidentiality of HIV testing. Ask the prospective subject if they have any questions and answer any questions they might have. Ask the subject to read and sign an informed consent form and any paperwork necessary for the procedure. To collect the specimen, first open the outer package of the device. Carefully open the pouch containing the Orasure Oral Specimen Collection Pad. Be sure to peel open the pad package far enough to allow easy removal of the collection pad. Then, offer the open pouch to the subject and instruct them to remove the pad from the pouch by firmly grasping the stick. Instruct the subject to place the pad in their mouth between their lower cheek and gum. Instruct them to slowly rub the pad back and forth between the cheek and gum until the pad is moist. Instruct the subject to leave the pad stationary in their mouth for at least 2 minutes to ensure that the oral specimen is fully absorbed by the pad. Keep track of the 2 minutes, but do not let the pad stay in the subject's mouth for more than 5 minutes. Note that before the laboratory tests an Orasure HIV-1 specimen, they will check for a specific amount of liquid in the vial. While timing the 2 minutes, remove the specimen vial from the outer pouch package. Write the test subject's identification and date on the specimen vial in the space provided on the label. Holding the vial upright with the pointed tip down, carefully remove the cap from the vial using a bending or rocking motion to prevent spilling of the preservative solution. After 2 minutes, ask the subject to remove the pad from their mouth and instruct the subject to insert the pad into the vial and push it all the way to the bottom of the vial. Ask the subject to bend the handle against the lip of the vial until the upper half of the stick snaps off. Replace the cap, making sure you hear the snap. That snap means the cap is properly seated in the vial. Be sure to handle the vial with care. The tip on the bottom of it is made to be broken. If you're not in a medical setting, put the vial in the sealable container or BioShield bag provided to you by the ordering physician. Protect the specimen from impact, direct sunlight, and temperatures over 98 degrees Fahrenheit. If, for example, it's a hot day, putting the specimen in a styrofoam or a plastic cooler with a cold pack would be advisable. Carefully handle and transport collected Orasure HIV-1 specimens according to the physician's instructions. It's important to keep in mind that the preservative only works for 21 days with fresh specimens, and the laboratory must complete all its testing of the specimens within 21 days. Now let's review. Remember that for each Orasure HIV-1 specimen collection, you should have the following materials: an Orasure HIV-1 oral specimen collection device, the Orasure HIV-1 package insert so you can consult it to answer the subject's questions, or give it to a subject to read or keep when requested, a subject information pamphlet to be given to a test subject or read to a test subject prior to the specimen collection. The back of the pamphlet has important information on Orasure, HIV, and AIDS. For each Orasure HIV-1 specimen collection, you will also need the following materials that are not provided with the device: a timer capable of timing 2 minutes to be used to time a specimen collection, a BioShield bag or similar sealable container if the specimen is not collected in a medical setting to handle and transport a specimen, a styrofoam or plastic cooler with a cold pack to protect a specimen if it will be exposed to heat over 98 degrees Fahrenheit, an informed consent form consistent with the law of your state, and information about your state's laws on confidentiality of HIV-1 testing. Before you collect an Orasure HIV-1 specimen, you need to explain the product to the subject, including its use and limitations, explain to the subject the meaning of a positive, negative, or indeterminate test result, including that test results are wrong more often using an Orasure HIV-1 specimen than using a blood specimen. Give the subject information pamphlet containing information about Orasure HIV-1, HIV, and AIDS. Give the subject an opportunity to read the materials. Tell the subject about their rights regarding the confidentiality of HIV-1 testing. Ask the subject if they have any questions. Answer the subject's questions. And have the subject read and sign an informed consent form and any paperwork necessary for the procedure. To collect an Orasure HIV-1 specimen, open the outer package of the device. Carefully open the individually pouched Orasure oral specimen collection pad. Be sure to peel open the pad package far enough to allow easy removal of the collection pad. Offer the opened pouch to the subject and instruct the subject to remove the pad from the pouch. Instruct the subject to place the pad between the lower cheek and gum and slowly rub the pad back and forth between the cheek and gum until the pad is moist. Instruct the subject to leave the pad in the mouth for 2 minutes. Keep track of the time the subject holds the pad in the mouth. Do not allow the subject to hold it longer than 5 minutes. While timing the 2 minutes, remove the specimen vial from the outer pouch package. Write the subject's name and the date on the specimen vial. Holding the vial upright with the pointed tip down, carefully remove the cap from the vial using a bending or rocking motion to prevent spilling of the preservative solution. At the end of specimen collection, 2 minutes, ask the subject to remove the pad from their mouth, insert it into the vial, and push it all the way to the bottom of the vial. Ask the subject to bend the handle against the lip of the vial until the upper half of the stick snaps off. Replace the cap, making sure you hear the snap. That means the cap is properly seated in the vial. Handle the vial with care. The tip on the bottom of it is meant to be broken. If you are not in a medical setting when the specimen is collected, put the vial in a sealable container, such as a BioShield bag. Protect the vial with the collected specimen from breaking, direct sunlight, and from temperatures over 98 degrees Fahrenheit. And finally, transport the specimen according to the ordering physician's instructions.
We hope that you will find Orasure HIV-1 to be a valuable tool. If you have any questions, please call toll-free at 1-800-869-3538.